Welcome back. Today on News Channel 11 at 5 o'clock, we're continuing to ask the experts. We are doing it outside the studio today, doing our best to maintain social distancing, and we're doing it with the help of an expert we've turned to a lot. This is Dr. David Kershke. He's with the Northeast Regional Health Office.
Howdy.
Great to see you at 6 feet distance.
Yeah, I won't shake your hand.
No, you won't do
hi.
that. But we thank you very much. We did see an increase, well, I'm not going to label it. We saw an increase today in Washington County, up now to 6 cases in the county. What can you tell us about who those cases are and how those cases were determined?
Yeah, so we have, I think we're reporting 10 cases in our region, so between Washington and Greene counties. All of those cases are either associated with travel or they're a contact to a case. So we've not seen any case where we don't know what the risk was. So we've not seen anything that indicates community spread, although I will say there's been community transmission in other places in Tennessee, and I would urge everyone to consider that there could be community spread going on. So just to take all the public health recommendations seriously.
Because it's important to note that these are just the people who've been tested.
Exactly.
Right? I mean,
yeah, and testing still is a little bit limited. We're able to test all the high-risk people that we want to test. But widespread testing in the communities not necessarily going on at the level we would want. ETSU and Ballard are testing people, so testing is increasing all the time.
Let's go to Greene County, where it went up to 4, and Tusculum College has said 2 of those are Greene County. Do you have any other information on the 2 others? You're saying that they've come from travel outside of the area, is that right?
Yeah, so I'll just say of the 4 cases in Greene County, all of them really had travel exposure.
And was it international or international and domestic?
I don't know off the top of my head, but I think it was all domestic. Yeah.
All domestic. The recommendation, to the frustration of some, has been that not everybody needs the test at this point, that those who have had a risk factor such as travel or exposure to someone who's positive, those are the ones that should be tested. What's the update on that? Are you still thinking that that's the best advice, that not everyone should be tested yet? I know not everyone can be.
Yeah, so because not everyone can be, we are trying to test people that are at higher risk. So either a contact to a case, someone with a suspicious travel history, or someone that would be a public health risk if they were positive. So healthcare workers, people in nursing homes where there would be potentially a lot of spread to other vulnerable people.
We have people who are coming back from spring break. We have people who are coming back from the state capitol. All areas, we have people who are coming in from Knoxville. All areas where there is community spread confirmed. What is your advice to anybody who has traveled to an area where there is confirmed community spread of COVID-19?
Yeah, so the CDC recommends considering what's going on in the community if you are planning to travel. In general, we don't recommend long distance travel. But if people do travel, they should know when they come back, there is the possibility if they find out they were exposed to a case that they will be quarantined for 14 days, so no work or going outside the house for 14 days. For people that don't have a known travel, so they have traveled but don't know that they've been around a case, we do recommend that they monitor their symptoms for 14 days, so check their temperature, just keep track of how they feel. And if they do get sick, they should self-quarantine immediately, or self-isolate rather.
So if they're not symptomatic, it's okay for them to go out and about or not?
As long as they've not been around a known case or been told they've been exposed.
Okay. Let's talk about the calls you're getting before we talk about some of the other numbers. We're hearing that people are still going to work sick. Are you hearing that, and what's your advice to people regarding going to work while having any symptoms that could be even close to this?
Yeah, so we are still getting calls about people showing up at work sick. It's not okay. And really, the more important you think your job is, the less okay it is. Because if you do become a case, your whole job's going to be shut down for 14 days while all your coworkers that you've exposed are in quarantine. So we really urge people to stay home when they're sick, please.
Let's talk about that quarantine circle for those 10 cases in your region. For every person who's confirmed, how many people are having to go into quarantine or isolation because of that?
Yeah, so for our current cases, it's between like 6 and 20. It's different for different people depending on how soon they self-isolated when they started having symptoms. But yeah, I would say between 6 and 20 people. And we're keeping track of those people that are in quarantine. At the first sign of any illness in those people, we would test them to determine if they're a case.
We're hearing that this is far more contagious than the flu,
right.
The regular flu, if there's such a thing. That maybe for every flu confirmed there's 1 or 2 transmitted sharings
Yeah.
of this, that that's higher with COVID-19. Of the confirmed cases, how many of these new cases are people that had contact with those who previously had been confirmed? Do you follow me on that?
Yeah, so it's hard to say exactly because some of them had also travel exposure or traveled together. But certainly we've seen up to 4 cases associated with 1 case that were contacts. So
Proving out that it's very
yeah,
contagious.
exactly.
We're seeing Knox County take some pretty drastic steps today, ordering non-essential businesses to essentially close down. As a public health official, does that bring a smile to your face? Not that it's creating, I know, a lot of economic pain, but are you happy to see stuff like that happening, and why?
Yeah, so it's always a little bit painful because we have to weigh the risk and benefits, and also obviously, or not the risk, but the costs and benefits. So the cost to like the business owners and stuff, it's always hard to pull that trigger and do that. But in terms of what we're seeing around the country with increasing numbers of cases, I think it's not unreasonable to take those kind of actions.
Would you welcome it here in the Tri-Cities, in Northeast?
Perhaps eventually we'll come to that.
I'm seeing the numbers go up, and we've been telling ourselves and others it's going to happen. You said it days ago.
Right.
The numbers are going to go up. But when you see them go up above 600 with 2 deaths in Tennessee, it begins to feel like the curve's not flattening, the curve's not flattening.
Yeah.
Help us have some perspective on this. Are we seeing a failure of the attempts, or is that the wrong way of looking at this?
Yeah, so I think really the way to look at it is our testing is increasing daily. So the more testing we do, the numbers are going to go up faster. But on the other hand, I think we should assume that there is community spread going on across Tennessee potentially, and people to really just take the public health messages to heart. We really urge people to try to stay healthy, so follow all those guidelines. If not for yourself, think about for the people you're with, especially vulnerable people. So do everything you can to try to stay healthy and follow those public health recommendations.
Final question: of the 6 in Washington and the 4 in Greene counties, are they in hospital or are they home? Give us an update of where they are and what they're doing tonight.
Yeah, so none of our cases are currently hospitalized.
So they're able to self-quarantine at
Yeah,
home?
so they're at home in isolation, yes.
So that is good news, it feels
Yeah,
to me, right?
Yeah, very happy about that.
And are they recovering well? I mean, I think people are just hoping to know, how does this play out?
Yeah, so far everyone, is recovering well.
Final and urgent message to anybody tonight, what is it?
Really, I think the thing we're hearing most about is people showing up at work sick, so we urge people do not go to work sick. Again, it's not okay to go to work sick. And really, the more important you think your work is, the less okay it is to go to work sick, because you're going to shut down the whole business or agency.
All right. Dr. David Kershke with the Northeast Regional Health Office, thank you for coming in.
Thank you.
And letting us talk to you outside the
outside
parking
in the
lot.
rain, yeah.
We appreciate it. Stay with us, more of News Channel 11 coming up.